Tweet @TodaySOR.
For the third time this morning, I've just been asked about the tie I'm wearing. I don't wear ties often these times, but I'm wearing one which I suppose is appropriate for the discussion I just had. It's the British-Irish Interparliamentary Body Tie. You'll be glad to know it's got the crest, the harp and green on one part of it, and then the strand above it has the crest of the House of Commons, a present from an old friend, Mike Burns. But anyway, and that question has been put to me by Dr. Regina McQuillan, Chair of the All-Ireland Institute of Hospice and Palliative Care. She's here with me, indeed, along with Evelyn Wakefield from Offaly, who is living with breast cancer. And they're here to talk about the fact that next Sunday sees the start of Palliative Care Awareness Week, the fourth year of the campaign organised by the All-Ireland Institute of Hospice and Palliative Care. And the focus of the week is to get the public to question their understanding of palliative care and to encourage people to find out more. Evelyn, to you first. You are somebody who's had to use palliative care and to draw on it. Tell me your story.
Okay, well, to start with, I was diagnosed with metastatic breast cancer in June 2014. Metastatic breast cancer meaning I have stage 4 cancer and it's terminal. So from there on, I was given 2.5 years to live. So I continued on my treatment, my chemotherapy, my radiotherapy, and all went relatively well until about January of 2016, when I started to experience severe backache and lack of mobility in my legs, and my left leg in particular, and my left hand side down my arm. So at a consultation with my oncologist, he suggested introducing palliative care. It came as a huge, huge shock and fright to myself and my husband, because our understanding of palliative care was end of life, that basically the team were going to come in, nurse me, give me the best chance I could for the following 3, 4, maybe 6 months, but that basically I was heading towards the end of my life. So the team called me, the nurse rang me, and she said about coming out to visit me, and I was like, oh, I don't really know if I want that. I'm afraid of this. I don't know where this is going to lead me. And she explained to me, quite frankly, that she wasn't just there for end of life. She was there to kind of guide me, give me back my quality of life, which is basically what they did. They came into my home.
Tell me a little bit about your family situation, Evelyn.
Well, I was 33 at diagnosis. I had 2 young children of 3 and 9 at the time. And I was married and living in Offaly. I'm the youngest of 4 children at home. My father had died 18 months of a heart condition before my diagnosis. So,
Yeah, just looking across, I mean, you're at least 6 months, if not a year, past the stage that you were told you'd be dead by, right?
Yes, absolutely.
And you look like you're going nowhere in any kind of a hurry.
No, and I don't intend to. No, absolutely not. I have been very, very lucky. My cancer has been stabilised. I was very lucky. The medication that they have given me have kept it stable. I have had no disease progression really since my diagnosis.
Right, and what was the programme of palliative care then that you were able to draw on? I mean, what things kind of started to happen?
Well, the first thing they had to do was stabilise my pain. I was losing power down my left hand side, so it was affecting my driving and that. So they just tweaked medications, introduced quite strong high-end meds really. But we gradually got me from where I was in a state of being in bed maybe 18, 19 hours a day to now being up relatively normal. I was getting up at 9, 10 o'clock in the morning, and I was staying going till 5 or 6 o'clock in the afternoon. And then from there, they introduced the social worker because my children are young, and a big thing I wanted to do was develop memory books for my children. I had no idea where to start, how to go about it, what I should, what I shouldn't put in. So the social worker came in and she has guided me and helped me. Now we're only starting to put the crux of it together now, but we've all the information together because I want something to be able to leave for my children if and when the time comes.
But have you started to think in terms of, look, we mightn't need to call on this stuff?
Yeah, we mightn't. No, I don't believe I'll ever not have to call on it. The day will come eventually that we will, but I'm still hoping that day is 5, 6, 7, 10 years down the road. But I want to be prepared because I have seen friends with a similar disease to me who have gone pretty well and next thing have been dead within days.
Yeah, Regina McQuillan, Dr. Regina McQuillan, chair of the All Ireland Institute of Hospice and Palliative Care. Would it be true to say, or fair to say, that Evelyn Wakefield's story is untypical, or maybe she is typical of people who actually have a good story to tell?
I think she's typical of people who have a good story to tell. I think traditionally palliative care would have been very much associated with people who are very, very near the end of life, and very much associated only maybe with people with cancer. But Evelyn is typical in that most people with palliative care who receive palliative care have cancer, but not only cancer. But I do think that we're now, as in the healthcare service, sort of helping people live longer with life-limiting illness. So you're living long with life-limiting illness, but the palliative care side of things is when you're focusing on quality of life and symptom control.
Yeah, because I think a lot of people will be saying, look, palliative care, it's a bit like saying, look, the doctors have done all they can, make the person comfortable.
Yeah. And I think palliative care is about making the person comfortable, but not saying that you can have active anti-cancer treatment alongside palliative care. It's not an either or.
Right, and what are the elements of it then?
So if you think about palliative care, the elements you would be focusing on are things like managing symptoms such as pain and sickness, trying to have good communication between the patient, their healthcare team, the patient and their family, and a degree of future care planning. So sometimes the future care planning might be about, a person might be talking about their own health and what they might want. Practical future care planning, like things such as wills and that type of thing, but also future care planning for your children. So palliative care tends to try and focus on those things. It's not just about the future care planning, but it's about trying to help you live better with life-limiting illness.
You're working on a pretty broad canvas, really, compared to what people's kind of traditional, stereotypical view would have been. Yeah,
and I do think, because I think palliative care services, specialist palliative care services, work in most people who receive specialist palliative care are at home in their own houses, and they get in community palliative care services, who are nurses mainly, but also doctors or social workers or physiotherapists, seeing people in their own home.
Yeah, I was going to come back to you, Evelyn, and ask you just to return or take us back to the time you got this diagnosis. You mentioned you had two young children, one of them 9, the other, was it 3 or 4?
3, yeah.
And how did you go about telling them?
Well, for my 3-year-old, we kind of just sailed through it, and we just told her mum was sick, and we kept it very, very basic, because she was only 3 and she didn't need to know a whole lot. But obviously for my 9-year-old, it was a completely different story, because obviously he'd spent 9 years with mum, been healthy and well, and now we were heading into chemotherapy, loss of hair and everything. So it just happened a few days after I was diagnosed. I was in the house on my own with him, and I just turned down to him and I said, look, mum has been up and down to the doctors about pains in her back, and we've discovered Mammy has cancer. He got very upset, obviously, straight off, but I explained to him, look, there's new medicines out there that can help us. I'm not going anywhere time soon, but that it was going to be a very, very different household, and it has been a very different household, where I've had to draw not only on palliative care services, but obviously on friends and family to help me, because there are days that I amn't able to do what a normal 36-year-old mom is able to do. But I have found through the services of the palliative care team that not only have I support and understanding of my illness, and have they made me more mobile, they've also worked with my children. My children now know the nursing team coming in and out. So if and when the time comes, they have a familiar face. They have somebody who can sit down and talk to them. And that's the big thing I found about palliative care. I thought I'd have to go into a hospital setting, but it's delivered in my own home, and there's no time restrictions on your appointments.
What kind of time do you get from people? I mean, how many different people? You have a social worker and a nurse?
I have a social worker and I have a nurse. They also have arranged home help, so I have 4 hours home help to do heavy cleaning in the house. I had a week, yeah. I also had physiotherapy when I had lack of mobility to get me back up and running, get me a TENS machine, that kind of thing. And they worked on getting me a hospital bed, clippy things to lift up stuff off the floor, that kind of thing. So, and they help then when it comes to the filling out of the forms, because unfortunately when you get this diagnosis you don't get a medical card for life, so you've all that work to do, and that's very, very stressful when you're dealing with everything else. So they help you fill out the forms. They will make connection with the necessary organisations to get those things sorted for you.
I suspect, Dr. McQuillan, I know the answer to this question before I ask it. Sometimes it happens, but how are you for resources to provide palliative care?
I think I suppose around the country the service have developed unevenly around the country. So I think practically everyone who works in health service will say you're under-resourced. So for instance, Evelyn lives in the Midlands. She's got a community palliative care service, but there's no inpatient specialist palliative care or hospice unit in the Midlands. Similarly, in the North East, there isn't an inpatient specialist palliative care unit. So those are the two main areas at the moment where there isn't that. Whereas in other parts of the country, there may be a community palliative care service, but they may not have social work input or physiotherapy input. So there's an uneven development around the country. The HSE is committed to developing this, but at the same time, it's committed to developing this alongside lots of other things.
Yeah.
So I work at St Francis Hospice in the north side of Dublin. So although we are funded by the HSE, but we're 70% funded by the HSE, 30% funded by charitable giving. So there's those sort of balances that you have to make in trying to develop services.
Yeah, Evelyn, here we are, 1st of September, start of another school year. I'm sure your kids are school going. I mean,
yeah, delighted. I was leaving this morning at silly o'clock.
Yeah, and I mean, would you hope now, for instance, to be able to get them out to school? Do you have the strength to do that, for instance?
Generally, but if not, my husband is there. I'm lucky he has a very, very local job. So yeah, I am lucky that my eldest has gone to boarding school, so that has taken a huge pressure off us. So I only have my 6-year-old to get out, and she's a very independent child. She's had to be. She's grown up in a different home to most children, so she just has to have learned to do things that maybe other 6-year-olds don't do. But that's no harm. It'll be the foundation of her for life. But my home help coming in and doing the heavy cleaning, or like they can help prepare dinners on a day maybe I'm not able, and that kind of thing is just so invaluable to me. And like that, my nursing staff, when they are there, like if there's anything I need done or any help, they will. They don't stick to the criteria of nursing me. If I need anything else, they will help. And I just find it an invaluable service, and I just wish it wasn't so uneven around the country, that every patient, and the big thing is for people not to be afraid of palliative care. It's not a thing to be afraid of. It's not an end of life. Like, I've had palliative care since February 2016. This is a year and a half ago.
Yeah, how long did it take you to realise, actually, this isn't the end or anything like that? This is just something that's going to help me through a particular stage?
It probably took me about 3 months. Obviously, initially, I thought that I was head because I was fitting into the time frame of the 2.5 years, because I was 2 years nearly diagnosed. But about 3 months into it, when I started to feel better, and I was literally got up one morning and had my breakfast, had a shower, was tipping around the kitchen doing a few things, and I was like, whoa, I haven't done this for 6 months. And it was just the realisation that, do you know what, I can live a relatively normal life. And I always refer to it as relatively normal. But I always say I wouldn't be sitting here today if it wasn't for my palliative care, for my oncology team, my friends and my family, that I only get to do these things by all the work that everyone else does around me.
You mentioned, Regina, about how it's usually associated with cancer, but what other illnesses or conditions might it be available for?
So it would be available for people with, say, bad heart failure, bad lung disease, people with motor neuron disease, other neurological problems. So the number of people with illnesses other than cancer who are getting specialist palliative care is increasing all the time. That's been increasing over the last number of years.
Well, look, I think you've both helped to enlighten people greatly in the last 15 minutes or so, and thank you so much indeed for coming in. Sunday, as I say, the start of Palliative Care Awareness Week. My thanks to you, especially Evelyn Wakefield, cancer patient. Long may you live.
Thank you.
And also thanks to you, Dr. Regina McQuillan, Chair of the All-Ireland Institute of Hospice and Palliative Care. News after these.
Today with Sean O'Rourke on RTE